If you sit for long periods of time and suffer from lower back pain, you need to treat the psoas muscle. So one common treatment for lower back pain is we treat the psoas muscle. So the psoas muscle attaches to the front of the lower lumbar spine, so the lower back there, and what it does is it dives deep through the pelvis and attaches onto the femur. And a lot of times what will happen from prolonged sitting, or even like cyclists will get this, so anytime you're in a flex position like that, that muscle can tighten up and compress onto the lower back. So it'll add some pressure onto your lower back. And if you have a disc injury or you're dealing with lower back pain, it can irritate that area. So what we like to do in our office is we do a technique called active release technique. And what we do is we contact that muscle, and what we do is we stretch that leg out, and it helps to take that pressure off of the psoas muscle. Feels really good once you kind of release that tension. If you've ever driven for a really long period of time and you get out of the car and you're kind of hunched over, and a lot of times what's happened is that muscle has kind of contracted. And so that's the kind of release that we're going to do, is we're going to release that tension and take the pressure off the lower back. So what we're going to do is the patient's going to start in this position here. Her knees are kind of bent up, and what that's going to allow me to do is to kind of palpate deep through her abdominal cavity and to get to the muscle there. And what we're going to do is we're going to tension on the muscle, and then I'm going to have the patient, she's going to kind of bring her leg down and back with a slight knee bend there. Bend your knee a little bit, and she's going to bring it back down like this. Now what I'm going to do is I'm going to prevent her hip from rolling back, and that'll help to concentrate the stretch. What we're going to do is she's going to kind of reach down and back with her leg like that. Once we get her leg extended, I'm going to have her put her arm over her head like that, and that's going to help to accentuate the stretch. To perform ART, I'm just going to start to palpate down. And once we get on the tissue, the patient will feel it. Okay, there we are. And I want you to bring your leg down and back as far as you can. Good. Now put that right arm above your head. Reach to the wall above you. Good. And relax. And then bring it back up. Again, I'm going to palpate again and go ahead. And reach down and back. Great. And then
feel the stretch.
Yeah, it's a great stretch. It's a little bit uncomfortable to get done, but it'll feel great when we're done. And go ahead and reach down and back. So that is how we perform ART on the psoas muscle. So the next portion is I'm going to show the patient how to do these stretches at home to help release the psoas muscle. To stretch the psoas muscle at home, what we're going to do is we're going to have the patient get into a fencer stance. So what she's going to do is she's going to bring one leg forward, one leg back. And what we want to do with her trail leg, the rear leg, is we want to rotate the foot in. And what that's going to do, it's going to internally rotate her hip, which is going to allow us to get more tension on the psoas. Then what she's going to do, keeping her back really straight and vertical, she wants to lunge forward a little bit, and then she's going to take the left arm to stretch the left side and go overhead, and then lean a little bit toward the right. And what she's going to feel is a stretch right in the front side. And this is a good stretch, again, if you just to kind of relax that psoas and to release some of that tension in that area. And you want to hold that for 10 to 15 seconds. And relax, do the other side for 10 to 15 seconds, and then come back and do the other side again and do that set as well. The second psoas stretch we're going to do it in a half kneeling position. So what we're going to do is we're going to have you get down onto one knee. And if we're going to treat the left side, she's going to bring her leg forward a little bit. And then on the rear leg, what she's going to do is she's going to bring her leg out. So her knee's still there, but her foot is out. And again, what that's going to do, it's going to rotate her pelvis and help this get us more of a stretch. So in that position, same thing as the standing one, she wants to keep her back really straight. She's going to lunge forward, and then she's going to put the left arm over her head. Good, and then lean slightly away. And again, what that's going to do, it's going to open up that psoas muscle and help to release that tension. Again, you want to hold it for 10 to 15 seconds. Do the other side as well. Come back, do the other, and do both sides again for 15 seconds. So that's the half kneeling stretch for the psoas. To stretch the psoas muscle in a standing position, what we're going to have the patient do is she's going to, if we want to stretch the right side, she's going to take a step forward with her left. And then what she's going to do is she's going to rotate her foot inward. And what that's going to do is going to rotate her hip, internally rotate her hip, which is going to help to stretch more of the psoas. Then what she's going to do, she's going to keep her back really straight. She's going to lunge forward, and then she's going to put her right arm over her head and then tilt away from that. And again, that's just going to open up the psoas in the front here and stretch that. The second stretch for the psoas is going to be in a half kneeling position. So what we'd like you to do, let's have you go on one knee. So if we're stretching the right side, that knee is down. And what she's going to do is she's going to internally rotate her hip by bringing her foot out like that. Okay, and what that does is kind of rotates the hip and allows us to get more of a stretch into the psoas. Now what she's going to do, keeping her back really straight, she's going to lunge forward, and then she's going to take the right arm and then reach overhead. Good, and that's going to open up the psoas on the front side there on the right side. And she wants to hold that for 15 seconds, do the other side for 15 seconds, and then do that set one more time for another 15 seconds on each side. So that's how you would stretch the psoas in a half kneeling position. So if you're suffering from lower back pain, give us a call at 703-912-7822 or schedule online at novacarewellness.com.